Why are my lymphoma PET scan results unclear? Imagine sitting in a doctor's office, waiting to hear about your scan results, only to find the findings are not straightforward. That's a common experience with PET scans for lymphoma, and there are several reasons behind it. PET scans use a radioactive sugar called FDG to highlight areas of high metabolic activity, which often indicates cancer. But not all lymphoma types absorb FDG equally. For example, aggressive lymphomas like large cell or mantle cell lymphoma tend to show strong FDG uptake, making them easier to spot. However, some subtypes such as marginal zone lymphoma, peripheral T-cell lymphoma, or lymphomas in the brain, testicles, or stomach often absorb less FDG or show inconsistent results. This variability can make it hard for doctors to interpret the scan clearly or confidently. Another factor is that normal body tissues like the brain, heart, or digestive organs naturally use glucose, which can cause FDG to accumulate there. This normal uptake can sometimes hide lymphoma or mimic it, leading to confusing results. In addition, inflammation or infections can cause increased FDG uptake, even when there is no active cancer. For example, after chemotherapy, your body might have inflammation or healing tissue that shows up on the scan, making it tricky to tell if the lymphoma is still present or if the body is just responding to treatment. Timing also plays a role. The best results are often achieved when the scan is done about 2 hours after the FDG injection, giving the tracer enough time to accumulate in cancer cells. If the scan is done too early, or if the patient moves during the procedure, images can become blurry or unclear. Differences in how the scan is performed or how the images are read can also contribute to uncertain results. That's why close communication between your healthcare team and radiologists is so important. Sometimes, even after treatment, FDG uptake remains in certain areas. This can mean the lymphoma is still there, but it can also be due to scar tissue, fibrosis, or ongoing inflammation. In these cases, a PET scan alone might not be enough to determine if the disease is active. Your doctor might suggest additional tests, like a biopsy or another imaging study, to clarify the situation. Having a baseline PET scan before treatment helps compare changes over time and can make interpretation easier. Lastly, some lymphoma types are rare or complex, and their scans may require expert review or repeat imaging to get a clear picture. If your PET results are unclear, your medical team will likely consider other options such as MRI scans, blood tests, or tissue biopsies to get a definitive answer. Remember, interpreting PET scans is a nuanced process that combines imaging findings with your overall health history and other diagnostic information. Always discuss your results thoroughly with your healthcare providers so they can guide you on the next steps tailored to your specific situation.